There are three different degrees or levels of hypertension. There's primary, secondary, and complicated hypertension. With primary hypertension, this is the most common. About 85 to 95% of cases fall into this category. Primary hypertension, there are several contributing factors that causes the elevation in blood pressures. We see a genetic component in primary hypertension or predisposition, which is why family health history is so important. With this genetic predisposition, that cannot be influenced. Of course, we can't change that factor. We can change some other contributing factors, though. We do see increases in blood pressure when there's an event that's stimulating our sympathetic nervous system. So we have that increase in our heart rate and our blood vessels constrict, and that does increase our blood pressure as well. This can be referred to as the fight or flight response. If we are in an acute or even in chronic stress conditions, we can see this occurring with the hypertension. So the kidneys will also play a role in hypertension at times. So one of the functions of the kidneys is to manage the sodium water balance in the body. So when we have this high sodium intake, our kidneys are holding on to water. This increases the fluid or the blood volume. If you can think of it this way, when you're pumping a higher volume through the same size tube, so to speak, that increases the pressure. Blood vessels are no different than that example. Environmental factors are playing into both of the above with the stress and the sodium intake. We're looking at diet at that point as well. We're making poor choices that can lead to obesity, impacts the workload on the body, and by doing so, we do inadvertently then increase our blood pressure as well. With secondary hypertension, this is a condition that has a cause that is able to be determined. So we are looking at people that have chronic kidney disease. We are looking at people that have endocrine disorders, occasionally people that have respiratory disorders as well. In complicated hypertension, this is an extreme increase in blood pressure. So a normal textbook blood pressure would be 120 over 80. With severe hypertension, this is then classified as anything greater than 180 over 120. At this point, the body is no longer able to regulate normally as it would because of the drastic and rapid increase in blood pressure. The lining of the vessels is also damaged as a result of complicated hypertension. So this affects the ability for those vessels to properly function. Injured vessels can lead to poor perfusion or blood supply to the body. So this is important for all of the organs in the body to function appropriately. Without adequate blood supply, organs slow down or stop working. Complicated hypertension is an emergency, and if it is not corrected, it can be lethal. So in your case, Mr. Jones, you're suffering from primary hypertension. I see a genetic predisposition as both parents were diagnosed with hypertension, and I also see several lifestyle factors that I would consider changing. I would like to applaud you on smoking cessation, and I would encourage that to continue. I would also encourage you to decrease the amount of alcohol that you are consuming. In addition to reducing the alcohol in your diet, I would also be mindful of the sodium intake. Again, we discussed sodium and water and fluid imbalances earlier. In addition to the sodium, carbohydrates and fats are something that I would keep an eye on as well, making sure that we are limiting those where we can, making healthy choices when we are, looking at your recent weight gain of 20 pounds in the past year. My suspicion is that diet plays a large role in that, and it would be high in fat and carbohydrates. That extra weight that you did put on does make the body work harder, like we previously discussed. And I also think that probably contributes to some of the shortness of breath that you are experiencing when you are exerting energy or exercising, walking up and down the stairs. In making those healthy choices, I would also encourage you to have modest exercise to try to decrease some of the weight that you have gained. This will also be helpful in not only lowering your blood pressure, but also in lowering the risk of developing type 2 diabetes, which your mom had. So with your stress component, your job is a high-level stress job, I'm certain. I would try my best to develop healthy coping mechanisms to reduce the impact of the high-stress environment, both in the short term where you have, maybe days that are a little bit more stressful than others, but also in the long range where you have, over a span of time, you're developing those experiences and you're accumulating the impact from that. Lifestyle modifications are implemented. If we don't see any changes in relation to those lifestyle accommodations that you have made, we would then look at medical management, seeing if medications can then take care of managing your blood pressure for you. If hypertension is left untreated, it can result in thickening of the cardiac or the heart muscle. This is left ventricular hypertrophy. This muscle thickens. It causes the heart muscle to work harder. It is not as effectively pumping blood through the body as it should be. And that can then, increase your risk for heart failure and also heart attacks. So the ultimate goal here is to reduce hypertension, reduce the excess weight gain that we have, so that we have not only a quantifiable life, but also we're looking at quality of life as well.